All right, we're underway. My name is Murray. I thought I'd document my cancer journey. I have esophageal junction cancer, or cancer in the esophageal junction, the gateway from the esophagus to the stomach. I was diagnosed. That'd be 2 months ago now. And I'm already 1 month into my FLOT chemotherapy regime. I've had two lots of infusions, and tomorrow will actually be the start of my third. So that's four lots over 8 weeks. So every 2 weeks they put you through it. And for those of you who know what I'm talking about, it's no walk in the park. Obviously, I'm not a professional presenter, so you'll have to excuse me if the time frame is slightly askew. I'll try my best to recount things to date, and I kind of hope, like what's happened with me, I've sort of drawn down on some of the experiences of others. Of others who have gone through what I've gone through, and I've found it quite helpful. So about 12 weeks ago, 3 months ago, I had a few months of on and off with indigestion and food getting sort of stuck in the sort of lower stomach area, and I just put it down to not swallowing food or just gulping food down far too quickly. So, but it did get worse, and it got to a point where I thought, right, I'll obviously go to the hospital. They did the colonoscopy, and they did the endoscopy as well. Got some clothes drying there. Hopefully that's not too noisy in the background. I'll just stop that. No, I won't. Anyway. They knew straight away, actually, without even getting any test results. The oncologist said he thought it was cancer, so that was just devastating, as you can imagine. Very difficult to explain the out-of-body experience. I felt like I was just looking down at myself, actually, and, and a very dry mouth, and went for a glass of water, and sort of a panic attack, the whole lot, as you could imagine. And and then 2 weeks, of course, later, then there was the staging. So you really don't know for at least 2 or 3 weeks, how severe it is. Stage 2 for me. They said it hasn't migrated or gone through to any lymph nodes, although they said there was a suspicious lymph node. What that means, I don't really know. But anyway, I was actually overseas at the time, so and then I flew straight back home, and I was just away on business. So it was everything suddenly stops, as you know. The first FLOT chemo regime just completely bowled me. I had every single symptom of all the whole booklet of not symptoms of side effects. The big thick pamphlet they give you with all the side effects. I think I had every single one of them to a degree. The worst of which was kind of like a black shroud of vision coming in. Like I get migraines every now and again, and I liken it to a migraine of not being able to see properly. That was kind of disturbing for a few days. But everything happened to me, the whole works, exhaustion, feeling discombobulated or just not with it at all. But one thing that happened, I was struggling to eat properly and even drink water for a few weeks, really struggling to get that down. They were thinking about putting a tube down my nose or straight into my intestine, I think it was. But then miraculously, on about day 7 after the first round of chemo, I started to be able to swallow food, even if it was mushy, but certainly liquid as well. Because I had checked myself back into hospital, actually, and they put me on a drip which gave me back, would you believe, just over 3 kilograms in weight. Just with fluid alone, because I thought, like most other symptoms, anything that was happening to me, it might, if I just wait a bit longer, bad things will it'll dissipate, and I'll feel better. But I didn't feel better, and as I say, I put myself back into hospital again, and they put me on a drip and managed to hydrate me, which was good. But anyway, so round about sort of day 8, day 9, after the first chemo infusion, I started to feel a little bit better. Like I was looking at one guy saying he started to feel like he was fighting back, and I did feel like I was feeling a bit normal again, and able to eat, and not eat everything, but just mashed potato, this type of thing, really well cooked, mushy sort of pasta, and very mushy vegetables. Drink just about anything, which was great, apart from fizzy drinks, of course. Just felt right enough just before round 2 started with the FLOT regime, and back in there again. Everything seemed to be amplified or accentuated, a lot more acute and more vigorous in terms of the side effects after the second round of chemo. I felt just absolutely wiped out this time. More tired, much more tired. The vision was even worse. I felt really dizzy. Lots of diarrhea, of course, and then you try to stop that, and then the opposite happens. I still don't know which is worse, constipation or diarrhea. I think constipation is worse, because you sort of feel like a stuck pig or something. Just very kind of massive pressure from the inside. It's not good at all. Or at least the other way. It's sort of things are happening. That's for sure. But anyway, so that's tomorrow I start my third round of chemo, third of the 4, before I'm supposed to have a month off, and then the operation, which it's one day at a time at the moment, and just getting through it all. So I really don't want to look too far ahead. Although people say be strong, which I hate. Be strong, be positive. Really impossible, quite frankly, when you're undergoing chemo. I mean, those people that waltz through it, I really envy them. But for me, it certainly hasn't been a walk in the park, as I say, and it's just literally torn through me and stripped everything that I've had, emotionally and physically. It's been absolutely horrendous, and I really haven't thought pleasant thoughts. But in saying that, once again, whilst there was initially some aggravation for the first week or so with my stomach, the last week or so, I've been able to eat, although I can't taste anything properly. But a good friend of mine, she's been cooking some fantastic food for me. Oh, just wonderful, sort of easy to eat foods, and they are just fantastic. I'm very, very lucky that she's doing that. I really am. It's just being able to eat makes you feel something like you're at least alive anyway. I'm probably leaving out a lot of things in terms of there's just so many meetings, oncologists, surgeons, clinical specialists, dietitians. There's even the anaesthetists or whatever getting ready for the surgery, which is still sort of 6 weeks away. Anyway, at least this is sort of documented, this first one. I mean, what have I lost in weight? I look at myself horrendously when I look on screen here. I was 108 kilograms. Now I'm 105. No, I'm not. I'm not 105. Sorry, I'm 95. So I've gone from 108, around about 110, down to sort of 95. I was 92 at one point. Just can't help it. Maybe I was a bit fat, so that's quite good. Fat and happy. I did like being fat and happy. But now I'm 95.1 actually. So, and that's just where things have stayed for a week or a week and a half or two. So I'm happy with that. I'm just happy that things aren't sliding down further. Anyway, thanks for listening, and I'll try and post again soon, probably after this third regime or third infusion that I'm getting into over the next 24 hours. Not looking forward to it. In fact, you sort of say, come on, right, I'm ready for you, let's have it. And when you do have it, you say, no thank you. No, I don't want it. It's not what I want at all. In fact, you're too much for me. But yeah, it's they say, to let them bombard you with everything they can, and it's not palliative or sustainative or sustainable, whatever it is. It's trying to be curative. And as my oncologists and surgeons say, as excited as they will ever get. Well, oh yes, Murray. That's how are you? We're quite hopeful with you, Murray. We're quite hopeful with you. Okay, sounds good. I'll take it. Given that 3 months ago I was feeling absolutely fantastic. In fact, I was feeling the best. What am I now? 58. I was feeling the best I have for 30 years at the beginning of this year. What are we now? We're in May. So February I was feeling absolutely fantastic, and now not so good. Anyway, thanks for listening, and I'll post again. And as I say, I hope just hearing about the experience with this esophageal junction cancer, stage 2, which is me. I hope it gives someone some kind of, I don't know, some sort of comfort, I guess, like what I've been listening to with other people when they go through what I've got. Just hearing, how they cope or don't cope, and which has been the case with me many times. Okay, thanks again.